Ladies and gentlemen, episode number 3, Therapy Tea Time Talk. We have a great guest coming on the show today. He's a doctor of physio, and he's also the founder of Physio Motion Lab. His name is Yi-Chun. Welcome to the show today, Yi-Chun.
Hi, Brad. Hello, Richard. Nice to have me here.
Thank you very much for coming on the show.
It's really my honor. I received your invitation. I'm so surprised.
Why surprised though? You're one of the best physios I know out there right now in the field.
Yeah, because you're saying, oh, come on, Yi-Chun, let's have some talk. I'm like, yeah, sure, I'd love to. We haven't been talking for a long time. And you say, can we do an interview? I'm like, oh, it's me? Really? It's me? It's it's a really big compliment to me. So thank you again.
Well, Yi-Chun, you are a very humble fella. I respect that. Yeah. All right. So today is about you. So people want to learn a little bit more about your story, how you got started, and how you got to where you are today. And I think just starting with the basic questions here first. So you're a doctor of physio. May I know how long you've been in the profession for?
So I graduated from Taiwan. So in Taiwan, physiotherapist is a bachelor degree. So I've been a physiotherapist for about almost 10 years.
That's a very long time with lots of experience.
Yeah, I didn't notice that until you asked me the question.
Because you've been there for a while already, right?
Yeah.
Okay, all right. So now in terms of the areas of physio that you have actually worked in, like maybe cardiorespiratory, neuro, or musc, which one have you had experience in all three areas?
Yes, actually I've been in every area about the physiotherapist, no matter it's in intern or after graduated, but I'm more focused on the musculoskeletal issue, and I work mostly in outpatient clinic.
So I assume that must be your favorite one to do, right? Since you decided to go into musc, is that correct?
Yeah, because as everybody know, most of like the cardio rehab or the neurological rehab is more like in the hospital setting. But to be honest, I don't really like the environment in the hospital, so I choose to go out, and the outpatient clinic is always my favorite.
So do you sometimes work a lot with the sports population as well in that case, like the actual athletes as well?
I do work with some athletes, but not like in the regular base, because for some professional athletes, they have their in-season game and out-season. And also for others, I work more with the amateur athlete. So I won't say a lot, but it's about like 20 to 30% of my clients.
So when you're talking about the athletes, are you referring to the elite athletes or athletes that does it recreationally? Could you expand a little bit more on that?
Sure, I do take care of both, just more amateur athletes, such as like the people they like to run marathon or they like to bike, but they do way much more than normal people. So they are the amateur athlete, right?
Oh yeah, that is definitely they still do a lot of it, right? But I'm sure at a competitive level too. But it's just like a different aspect of it,
Yeah, so it's just a lot of men, they do it for fun. They enjoy the exercise. They're not making a living from them. So they're still should be considered athlete in my opinion. They're just not professional athlete.
Yeah, most definitely. I mean, like they still do it on a competitive basis, but even at a recreational league, I mean, there's still a lot of commitment, right? And I think it's really great to see a lot of people with the whole overall passion with the exercise. It's just fantastic to see a lot of these people out there still, trying their best at the same time and, do the best in the performance and also, work together as a team and do it in a competitive environment. So I think it's fantastic in that sense.
Yes. So I don't really have the narrow or focused population. I do almost like the general population.
Okay, thank you very much for the elaboration. So my next question for you here today is, so tell us a little bit more. So I'm going to take you back in time now. So originally, how did you get started and what led you want to become a physio?
I'm a little embarrassed to talk about that because I think most people, if you are familiar with the education in Asia, we are really focused on how great you are and how good, how much point you can get in the test. So I'm not exception from that. I'm just a normal high school student. I finished my exam and I got my score. Then I started thinking about, okay, I do want to be a physician, but my score is not good enough to get the admission for the medical department. So what should I do? Then I choose the different kind of department with my sister. Then eventually we think, okay, physical therapy might be a good professional to study for. But to be honest, it's about 12 years ago. Yes, 12 years ago. I have no idea what is physical therapy until I get the admission for that. But well, luckily I do enjoy the profession. So yeah, I think I'm lucky enough to make the good choice.
I mean, it's got to be something that you enjoy, right? For you to do it
Yes,
for a
it's true.
long-term basis.
Yeah, I need to be honest, like in my freshman year, I still have no idea what is physical therapy. Not until the sophomore time, that was the first time I studied kinesiology. I'm thinking, oh my god, man, that's so fascinating. I love kinesiology. So you can tell that's why I'm more like involved in the musculoskeletal, because there's a lot of biomechanics and kinesiology. So yeah, I think I do have a good choice back to that time.
That's excellent. All right, so tell us a little bit more. So 12 years ago, you started, doing this at the same time. So, and down the line, and what led you to the path of wanting to do the doctor of physio down the line?
Yeah, so after I graduated in Taiwan, I finished my military responsibility, and I get the mission in Boston. It's a Mass General Hospital, Institute of Health Professionals. So I started my master's degree in physiotherapy in Boston for about almost 2 years. Then I started working in New York City. I keep, attending different kind of course, seeing more patients. Then I think it's a time to get the doctor degree of physiotherapy because, according to APTA, American Physical Therapy Association, they want every PT has their doctor degree after 2020. So that's the reason I choose to be a doctor. And also I want to know what's the difference between the normal PT and the doctor of physical therapist.
All right, so in that case, what would you say the difference between the two are?
If you're just talking about the clinical practice, in my opinion, I don't really think there's a huge difference between PT and the doctor of physical therapist. But in the doctor of physical therapist, they do involve more evidence-based approach. And you need to understand not only the evidence-based, but also you need to be able to differentiate this is a good research you can use to or it's not.
Yeah, evidence-based work is extremely important, I think, in order to help you develop a basis of your overall findings and, in terms of relating your hypothesis as well down the line to test that too. I totally agree with you on that one. And I was thinking now, we're going to talk a little bit more about, your specialization. Now, you specialize in doing MUSC a bit more, if I'm correct.
Yes.
And just wondering, in terms of your methods of, let's say, diagnosis and treatment, how do you think that has changed over the years along with your education as you continue studying?
Yeah, so I think when I was a new grad, I just have no idea what should I start in. I think every new grad has the same memories, right? You face your first patient and you try your best to helping them, but in your brain, it's all blank, right? So I just follow everything I was taught in the school and also everything I was taught when I was an intern. So it's getting some nice result, but you can start to find some puzzle or you can find something missed during your practice. So after that, I attend a lot of course, almost like every course you can think about, maybe I've attended before, then I try to integrate them in my practice. Then sometimes you'll find it's really good to combine with your own professionals. Sometimes it doesn't, and you need time to refine your skill to not only the diagnosis, but also the treatment, also the most important, I think, the exercise to get the best result to your client. So eventually, I think for the past about 10 years, I've been using much more simple way to exam or to diagnose my client.
So it sounds like, like what you've been doing has sort of evolved over time based on, what you learned and your experience, right? So I was wondering in terms of, let's say each one of your session, like what is the
Mhm.
duration of time for that? Like how long roughly is the session?
Oh, yeah. So just a little bit more information about myself. I'm a physical therapist mainly in New York City right now. I do the self-pay treatment, which means they need to pay from their pocket to me themselves. And in that case, I can choose how long in my practice session. So I know in average in New York City, you'll receive about 30 minutes session. But for me, I do use about 45 to 60 minutes per session.
And what would you say the ratio is in terms of the session split? Like from, let's say, history taking, from your actual diagnosis and doing the treatment, what is the portion or proportion of that like?
I think sorry. I think it really depends on what kind of case. But if it's a first visit, it's an initial evaluation. I usually have about 20 to 30 minutes history taking combined physical examination. Then I'll do about 10 to 15 minutes manual therapy, depends on their condition. Then the last 10 to 15 minutes to give them the home exercise and try to having them to keep the result as long as possible. But for the second visit or like the recurve client, usually we'll have like 10 to 15 minutes, just like, okay, ask how do you feel recently? What's the difference you feel? Then same, I'll have about like 10 to 15 minutes manual therapy to release the soft tissue we think that might cause the problem. Then I will spend 20 to 30 minutes, sometimes 40 minutes to do the exercise with them.
So in that case, would you agree that giving exercise to your patients and clients is extremely important?
Yes, I think that might be the most important part as a physical therapist, because think about your experience with all the doctors, right? You feel sick, you go to the clinic and you get the prescription, right? So as a physio, I think we should give our patient prescription, which is exercise. That's their medicine. That's their best medicine.
In terms of how much exercise you would give them then in that case, what is your opinion on that?
I've read a research talk about how much exercise you can give you to your client, right? So in the result, if you give them more than 3 exercises, no one will do it. There's no one. If you give them more exercise, like you have more pills, you'll feel tired to get everything, right? So for most of my clients, they'll only have no more than 3 exercise. Some of them, I prefer to have them do only 1 or 2 exercise. So in this case, how do you decide the exercise for them instead of general exercise will be extremely important.
And in terms of these exercises, would a lot of them actually incorporate the aspect of fixing the faulty biomechanics? So kind of like movement-based exercises, or would it be more catering towards like strength building from that aspect?
Well, that's a really big question, and it's a little bit tricky because I try not to upset some population who are really focused on what they're doing. But I do think it's a little bit arrogant to say we can change their biomechanics or we can change their pattern, because I think for me now, I feel like I'm more guiding them, guiding their brain or guiding their body to choose the best movement pattern for themselves. We try to avoid some kind of movement pattern which will make them feel discomfort or make them feel pain. And yeah, I don't think we can really fix them. Even though from the neuroscience, we cannot fix the motor pattern. We can only try to override it. So for me, I'll focus on how to do the exercise properly and what kind of exercise can give them best result depending on your physical examination and also the response from the client. I think it's really important to think about we don't really fix their problem because they don't have problem. It's their body trying to helping them doing the movement they want. I think the most important work for me now is guiding their body, guiding their brain to regain the ability to heal themselves, to regain the ability to move like when we were a child. there's no child has back pain or neck pain or knee pain, right? Why we have those problems when we grow up? Probably because we lose the ability to move correctly, or we lose the ability to choose how to move.
Yes, I totally agree. In terms of the overall aspect in relation to the modern day design of economics and everything, it does the environment does have an impact on the way how we do our things on a daily basis, and in terms of our lifestyle as well. So I really agree with what you just said there. So, and now just moving on from that part specifically, now if you were to give an advice to people that is looking to get into the field of physiotherapy, what kind of advice would you give them?
Yeah, I think for the people who want to enter the world as a physical therapist, they need to ask themselves, why do they want to be a physiotherapist? Because a lot of trainers I know, or a lot of coach I know, no matter in Asia or in America, they do want to be a physical therapist because they do really interesting in musculoskeletal issue. But there's way more things than musculoskeletal in physical therapy. So I think that's the only question that they want to ask themselves, why they do want to become a physical therapist. So for those who are already physical therapists, you're a new grad or almost grad, I think there's two things I'd like to share with you. So first, please remember you need to master the basic. I know there's a lot of course, a lot of systems, a lot of fancy stuff on the market, but no matter what course you choose or what system you follow, don't lost into the system. Every system, they must have their advantage and they must have their weakness. There's nothing can cover every aspect except the basic anatomy and kinesiology. So master the basic is the first advice for all the new PT. And I think that's the time I still learning the basic. I say the anatomy and kinesiology, I've studied that for more than 10 times, just the book wise. So please don't forget your basic. And the second advice, I think that's something I don't have in the past, but I do wish you can have one, is to find a good mentor. Find a good mentor can help you develop or can help you grow up way faster than you can think about. Try not to choose the clinic or the hospital you can only work alone. Find a good mentor, build a nice relationship, and you'll learn so much from them and become a good physio way faster than you can think about.
Thank you. That was a very elaborated response, and I think people can definitely learn a lot from this advice as well. In terms of learning basis, I do agree that it's totally important to be able to find a mentor and also learn from the experience. I think it's fantastic. And I was also wondering, so if you can now, let's say you can time travel, you can go back in time, and then you can talk to yourself before. What would be a piece of advice that you would give yourself?
Well, I think if we can go way back to before, I told myself study harder, you can be a physician. I'm just kidding.
Yeah.
I'm just kidding. Yeah, go back to the past. And you know what, I think there's so much things to learn in the future. So I ask myself to just, enjoy your life now. Just do the things you want. Don't leave any regret in your college or in your study life, because there's a lot of things way more important in study, and something you cannot do it after you graduate. So don't be afraid to make the mistake and try to enjoy your life.
So it's always about the learning, right? Would you agree?
Yes,
it's always about the
you'll
learning.
learn for your own life.
Yeah.
Don't be so rushed when you're in school.
It's like
There's
with,
way more things to learn in the future. Way more things to learn after you graduate, right?
Yeah, we're like the students of life, right? Would you agree?
Yes. Yes.
Okay, excellent. All right. Well, that's all the time we have today. Thank you very much again, Yi-chan, Dr. Physio, for coming onto our show today to tell us your story and share with other people some of the great advices that you have for them in terms of your life experiences. All right. So now, everybody, hope you can learn a lot from Yi-chan today. And We'll see you guys again next time. Again, this is Physi Leap's Therapy Tea Time Talk. Have a lovely day. Cheers.
Cheers.